Guys, let's move on and study the dog tapeworm, that is Echinococcus granulosus. Come on, you know it. Isme there is no tata, nothing happening. So you know for a fact that over here there are 4 suckers and there are gonna be 2 rows of hooklets. Everything is going fine. But what was the exception? Why am I calling it dog? Because here the definitive host and intermediate host is not man. The concept of calling it dog was that man is going to be an accidental host by having some contaminated food or water. Man is going to be the accidental host, because definitive host will definitely be the dog. That is why you call him dog tapeworm. And intermediate with sheep and other animals. So if you primarily see a life cycle, this is easiest to pick up. I'll tell you why. Look at the life cycle. Ma'am, primarily the life cycle is going between dog and sheep. Dog and sheep. Human तो बिल्कुल side पे accidental host है. So definitive host is gonna be the dog, intermediate host is gonna be the sheep, and by chance if we end up having some contaminated food and water, by some eggs, if my contamination has occurred in the food and water with some eggs, that is gonna occur in a human involvement. But like I said, not only are we accidental, we are also dead ends. Not only are we accidental, we are also dead end hosts that we have. So let's have a look at the disease that it's causing, guys. This is going to result in the very, very famous hydatid cyst. What do you see over here? You have multiple pearly white cysts that are seen. Multiple pearly white cysts that are noted, right? So imagine if I see what is inside. Let me look at this cyst altogether. Iska kya layers hai? What is the composition? So if I look at, it's a very pearly white structure, right? What is inside all these? Multiple cysts are there. What is inside all this? It has a fluid which has a pH of little acidic, 6.7. It has certain salts, and this fluid is antigenic. This means if I puncture and I rupture this fluid, the fluid can cause anaphylaxis and death in a patient. Do you want to rupture it now after listening to this? Do you ever want to do an FNAC in this case? No, FNAC is contraindicated. Remember, the fluid which is little acidic, which is going to have little salts, but most important, it is antigenic. It is definitely going to cause anaphylaxis. Do not puncture this cyst. FNAC is contraindicated. So this you've understood. But now I want to ask you that if you just surgically remove it, puncture nahi kara, surgically pura remove kara, if you look at this under the microscope, how is it going to look like then? What are the layers of hydatid cyst that you notice? What are the layers of hydatid cyst? So I see there are 3 layers: pericyst, ectocyst, endocyst. So first and foremost, pericyst is something which people have made. Pericyst is something which people have made. Matlab I have made. It is host derived. It is host derived. It is going to be nothing but inflammatory cells. Tell me, if a parasite comes into your body, you will make some neutrophils, monocytes, macrophages. You will make some inflammatory cells, na? So this entire inflammatory cell layer, where you're seeing all the normal part of the maybe liver mein hua ya lung mein hua ya jahan bhi hua, over there, plus all these inflammation, eosinophils, neutrophils, whatever inflammation is there, that becomes the pericyst. Okay? Then this to you will say, this is ma'am, this is to hamara contribution. What is parasite making? Parasite has ectocyst and endocyst. Ectocyst on outside, endocyst on inside. So what is the next layer? The next layer is ectocyst. What is it looking like? It's looking like a pink color line. Ectocyst shows you the famous paintbrush appearance. Very, very, very famous question. Ectocyst shows you the paintbrush appearance. And what do you see inside? Ma'am, finally inside I'm seeing all the organisms. These are the hydatid cyst wala organisms. So instead of just calling them organisms, they call it brood capsules. So when they use this very, very big term called brood capsules, kuch nahi ho raha, germination, new organisms are being made. So I'll write it in simple words. It is the organisms, or you can say, is this the germinal layer? Is this the germinal layer? Because all the organisms are forming over here. And finally, you'll say from outside to inside if I have to go. Outer layer is pericyst, which people have made host derived. Then ectocyst is going to look like a pink color paintbrush appearance. And endocyst is where all the brood capsules are formed. So what is there in the fluid? In the fluid, you see these hooklets, because obviously Echinococcus has hooklets, na? So you will see these hooklets also that are present. So please note, and if you go back to your general microbiology, I have taught you that hooklets of Hydatid are Zn stain positive. So now tell me guys that once you have read all of this, you have analyzed that okay, they are pearly white, their fluid is very, very dangerous, you've done the layers, tell me the organs. What is the most common site? The most common site, as we have been reading over here, is going to be the liver, and is usually the right side of the liver. Right side of the liver, in which it obviously means that the patient is going to have hepatomegaly. The patient is going to have hepatomegaly, and in severe cases, it can complicate as portal hypertension. Okay? Second most common site is going to be the lungs. Lungs means that the patient is going to have cough and there's going to be sputum, there could be chest pain. These are the different things that lung involvement happens. So kind of expected. Liver involvement hoga, so there's always hepatomegaly. Lung involvement always cough. So remember, most common site is the liver, and the second most common site is going to be the lungs. Then after that, to any other organ of the body can be affected. There is no end to that. But moving forward, this was all about the features. How do you do the diagnosis? Remember, you can do imaging. I think everyone knows that very famous radiology sign that is known as the water lily sign, that is so shown by Hydatid cyst. So Hydatid cyst shows you the water lily sign. Do you want to do the cyst fluid examination? Usually, will you want to do an FNCC? Not at all. It is contraindicated. But if you see a cyst fluid, what will you see? I already know. I'm going to see the presence of hooklets, and we have already studied that the hooklets are acid fast, Zn stain positive. These are the two tests where they ask you a lot of questions. एक test है पुराना वाला test. जैसे skin के लिए you have Montus ना, skin test. TB के लिए है ना, TB के लिए you have Montus. For this also they used to have a skin test called Cassoni test. No one does it now. It is totally obsolete. So just know Cassoni test. You know why? Because in Cassoni test, they used to actually inject a little bit of fluid. And since that time, I have been shouting, cyst fluid is very dangerous. Cyst fluid causes anaphylaxis. So imagine if I inject cyst fluid into someone, that person might die only. They said, oh, this is a very dangerous test. Ye wo type 1 hypersensitivity, anaphylaxis wala test hai. Please remove this. Don't do this. No one does it now. Now what is done is ARC5 immunoelectrophoresis. That is the newer test. So one old test question comes, one new test question comes. Old test mein Cassoni test, no one does it. Risk of anaphylaxis, very, very deadly. I don't want to get into it. New test is ARC5 immunoelectrophoresis. Now you will say that, ma'am, FNSC to kar nahi sakte. How are you going to treat this patient? There is a technique called pair. The first P will be a little worrisome. You know what we do in pair? We puncture the cyst. You will say, ma'am, since then you were only shouting, don't puncture, cyst is very dangerous. Now you are only saying puncture the cyst. But yeah, as soon as you puncture, you take out all the fluid. You aspirate all the fluid. The fluid should not spill into the person's body. Then it will cause anaphylaxis. Immediately aspirate. So for example, if this is the liver and over here you have the Hydatid cyst, first you're going to puncture and immediately you will take out all the fluid. You will aspirate it out. And you know after that what you'll do? You will give an injection. You will give an injection of 95% ethanol. Why? Because that is a scolicidal agent. It is gonna then kill the scolices, the brood capsules, the hydatids. It's gonna kill those. And once you have injected ethanol, you can't leave the ethanol there. Once all of them have died, you're gonna again re-aspirate it. You're gonna again re-aspirate it out. So I hope everyone's understood what is the pair technique. First you puncture, but don't worry, immediately take out all that dangerous fluid, aspirate it. Then you inject, give an injection of 95% ethanol, which means all the scolices and organism will be killed, and then you re-aspirate that fluid. Puncture, aspirate, injection, re-aspirate. That is what you do for dog tapeworm. Echinococcus granulosus. What am I going to do? Change one word over here, make it Echinococcus multilocularis. So you'll say, what is this multilocular thing? I'll say, hang on. Earlier, Hydatid cyst was looking like a nice cyst like this. Multilocularis is inside every cyst there will be multiple cysts. Multiple locules are going to be there. So this is also known as the alveolar Hydatid cyst. Now as soon as I say, oh, you know what I'll do? I'll tell you I would have also done that if I would have been in your place. As soon as I say Echinococcus multilocularis is alveolar Hydatid cyst, students say, oh, this means the most common site must be the alveoli. No, here also the most common site is the liver and the second most common site is the lung, which was the case in your previous thing also. In the previous situation also, Echinococcus granulosus mein also, the most common was liver and second most common was lung. Here also I'm saying the same thing. Most common is liver, second most common is lung. Then why are we calling it alveolar hydatid cyst? Because the structure looks like alveoli. Multiple locules. That looks like an alveoli. That is why we are calling it the alveolar hydatid cyst. Okay, so do you want to see in dono ka life cycle? Because that I have not seen. So for example, now how is this life cycle going to be different? You will say, ma'am, I can see human to isme bhi alag hai, human to isme bhi accidental hai, fine. But this story has changed. Over here you can still have the dog or the wolf, whatever. The story of the intermediate host has changed. Over here in multilocularis, you're going to have a chota sa rat. So now compare. See guys, if I go back to my hydatid cyst wala Echinococcus, we label it now. If I talk about Echinococcus granulosus, which was dog tapeworm, dog ya wolf, dono chalega. Dog ya wolf, dono chalega, but over here you had to see a sheep. You had to see a sheep, whereas over here in Echinococcus multilocularis, I am seeing dog ya wolf chalega, but over here I am seeing a rat. And if I see a rodent, I know this is kuch problem hai. This is the Echinococcus multilocularis that is happening over here, the alveolar hydatid cyst. Now, coming towards the end, the one who gave us life lessons, the one who is the smallest in size, the one who has only a single host, that is humans, and who has how many rows of hooklets? Only a single row of hooklets. So I told you the life lesson, na? Limited resources hai, but it has made the maximum out of it. This is the most common cystode infection. Do you know how is the life cycle going to look like? That I'll show you in a while exactly. But there is one cousin brother of this that I want to tell you. This is to Echinana, and we know everything about Echinana. Echinana is going to cause a lot of intestinal infection. ठीक है? There is a cousin brother of Echinana known as H. diminuta. See, now that is how microbiology is. If I would have thought of diminuta word, I would have felt this is the smallest organism. Diminuta, minute, but aisa nahi hai. I know that H. nana is the smallest, so they call H. nana as the dwarf tapeworm because H. nana is nano. That is how we've learnt it. H. nana is the nano car that we have, dwarf tapeworm, whereas H. diminuta is a rat tapeworm. Why rat? Because you will say, ma'am, ab compare karte hai. When I compare H. nana versus H. diminuta, firstly I need to know their names. This is a dwarf tapeworm, this is a rat tapeworm. Isme ek hi host hai, single host, human. Over here you've called it rat, so along with human there must be a rat also, na? That is why you've called it rat. So ho gaya different. Now you will say, how do their eggs look like? You will say H. nana looks like any other cystode egg. It's going to have the same. Let me show you that egg again. Do we all remember this egg that we did? How many hooklets will it have? It will have 6 hooklets. Will it have all these yolk granules? Hai na? Yolk granules hoga. It will have those 2 polar knobs also. All of that, ma'am, that we have studied earlier, H. nana ka to waisa hi chalega. Just like any other cystode egg it's gonna be. But when I talk about H. diminuta, look at the egg in front of you. 1, 2, 3, 4, 5, 6. Hooklets to same hai. Outer membrane is there. Inner membrane is there. But what happened to all the mess in between? Do you see any yolk granules? No, the yolk granules are missing. Do you see any polar knobs? No, those are also missing. So the polar knobs and the yolk granules are missing, and that is H. diminuta ka egg. So basically whatever mess was happening over here, na, the yolk granules and polar knobs, wo chale gaye, that is H. diminuta, and that is how you will make a final differentiation between these two, which is very, very important for all of you to know. Please note, repeating, H. nana is nano, it is chota, it has one host. Diminuta sounds diminuta, but that is how microbiology is. What sounds is not the case. This is not chota, this is rat tapeworm, because with humans there is rat. Now if I show you the life cycle, things will become simple. If it would have only had a human, the life cycle is happening between human, you would have called it H. nana. But if I say with human there is a rat also involved, you would have called it H. diminuta. Sometimes in H. nana also a rat can come. Aisa bhi hota hai. But again, this is not something I would want you to know. The best is just think about how there's a life cycle in the human and how there's one in the environment. Human is going to be the Echinana ka life cycle. Okay, so now moving forward, what are the clinical features? Because I've understood it's an intestinal problem, but what are the clinical features? Like any other intestinal problem, abdominal pain, nausea, vomiting, maybe diarrhea, and like any other condition, the treatment is going to be with praziquantel. So nothing problematic over there. Going all the way back, guys, to the first slide which I taught you, which I hope now will make a lot of sense to you guys, because that time you might be feeling a little lost. Host revise karna jaldi. Tell me the host of Echinana, single host. H. diminuta, human and rat. Okay, Diphyllobothrium, Diphishobothrium. So human and tutu fish. Okay. Then we had Echinococcus dog tapeworm. So dog, sheep, human side pay, accidental. Taenia solium and Saginata. Human to hai hi. Saginata is cattle and solium is gonna be the pig. So now you are ready maybe for some MCQs after so much of listening to me. So maybe you can start off by doing this one life cycle over here. Let's begin. Can you identify the life cycle? Best is, I see one animal here, and human ko aisa kaise side pe, you have ignored. So there is a dog and there is a sheep. If there's a dog and the sheep, I know I'm talking about the very famous Echinococcus granulosus. This is the dog tapeworm, and human is going to be the accidental host. Very, very good. Let's pick up the next one. Identify the life cycle. I see a human being over here, and I see one big wala fish over here, and I see one chota wala fish over here, which is cyclops. So if it is human to chota wala fish to big wala fish and back to human, so that is Diphishobothrium latum. Life is becoming easier, isn't it? Coming to the next, which of the following is not a cystode? Wow, what a question. So D. latum is a cystode, Taenia saginata, Echinococcus granulosus. Schistosoma is not a cystode. I'm going to teach you in the next chapter. That's a trematode. So that's the answer over here. Next question, which of the following has grooves on its head for attachment? Doesn't have suckers, no suckers, but grooves. And remember, two grooves. Diphyllobothrium latum. Di means two. It has two grooves. Next, infective form of this Diphyllobothrium latum. So I had said it had 3 hosts and it had 3 larvae. And out of them, the L3 larva was plerocercoid. Plerocercoid larva was the infective form that you had. Next question. ARC-C5 counter immunoelectrophoresis on serum is a diagnostic test of, I told you again and again, this is the new wala test of Hydatid. Remember, I said for Hydatid, one old wala test, Cassoni, no one does, and this ARC-5 immunoelectrophoresis now is being done. That is done for Hydatid. Coming to one last question. Larval form of which of the following cystodes is not seen in man? Not seen in man. So first and foremost, you will say that Echinococcus granulosus ka to dog tapeworm hai, usme to once it comes into us, what can I say? Now the egg is going to come into us. When I say I have taenias that are mentioned, Taenia saginata, Taenia solium, Taenia multiceps. So did I tell you that Taenia solium was sab kuch? The larva was seen in the animal also, in the